As clinical haematologists, I think one of the things I find the hardest is assessing symptom burden in patients with myeloproliferative disease. So there's been a lot of work looking at symptom scores such as MPN 10 in patients with myeloproliferative disease. It was interesting hearing Dr. Mark Drummond talking about systemic mastocytosis and looking that patients are also have symptom assessment scores for these conditions as well. I think this is really important because it then sets an objective standard by which you can measure patient symptoms, and then down the line when you start treating patients you can then have an objective measure to assess your treatments against. So I think that's certainly an everyday challenge, and one way to address it is to objectively measure these patients' disease. There's ongoing work on MPN 10 symptom assessment. Is that there's a lot of investment in patient tools, so there are now patient apps that patients can use to objectively measure their symptom scores on a day-to-day basis, so they can carry that around in their phone and they can use that. So that's using new technologies and trying to map their scores, but also there are also analogue methods where patient diaries are held and folders and files by which patients can record their scores. So certainly we are moving forward in helping patients document their own symptom scores to help clinicians in the clinical environment.